This presentation is sponsored by Cranial Release Technique.
The World Summit of Integrative Medicine 2015 presents Dr. William Doreste. William C. Doreste, DC, is CEO of Cranial Release Technique, Inc., a national training institute that he founded in 2005. The institute is dedicated to the advancement of the cranial release technique as a vital tool for healthcare practitioners worldwide in promoting wellness and reducing stress in patients and clients.
Welcome to this presentation on the cranial release technique. My name is Dr. William Doreste. I'm the CEO and the founder of the cranial release technique, which we'll probably call CRT from now on. And in this seminar, what we're going to be covering is, or this introductory preview seminar, we'll be covering what is the cranial release technique, how can it have such wide-ranging effects. So as a chiropractor, since 1985, I have been using all different techniques. And about 1998, it occurred to me that virtually 80% of the nervous system resides above C1, or the atlas. That then led me into looking at cranial work, and lo and behold, in 2005, I created the cranial release technique. What it did for me in practice was take my traditional chiropractic practice to a whole new level. I was helping patients with different problems, issues that I never really saw much change with traditional chiropractic, so I knew I was onto something. And we'll cover that as the presentation continues. Well, the benefits of adding cranial release to your practice, it is a 1-minute technique. It literally takes a minute to do, and it will change global physiology in the patient's body. And we will cover that in detail in just a little bit. Then we'll have a patient come up, we'll then do a practical demonstration. And by the way, it doesn't really matter what the degrees are after your name. If you're a chiropractor, if you're a dentist, if you're a body worker, if you're an acupuncturist, this is all applicable to enhancing global physiology. And then we'll talk about what we call the mastery class program. How is it that you learn this technique? And we have two ways to do that, through the live seminar or through the video library program. So let's get started. It was Dr. Sutherland that came up with the concept of the primary respiratory mechanism, this involuntary pumping mechanism of the cranium that all of us have from the time we're born until the time we leave this planet. It was Dr. Sutherland that said it's the system that comes first. It underlies all of life's processes and gives dynamism, form, and substance to all of anatomy and physiology. It's the spark that gives rise to the breath as it moves through the tissues. It's the foundation of metabolism, and it has both an inhalation and exhalation phase. Dr. Sutherland was absolutely convinced that the key to unlocking human physiology was through the head, and I have found that to be as well. So let's dig a little deeper. 2005, I come out with cranial release technique, and I found this slide in a British anatomy text. And virtually everywhere you look at the slide, you see distortion. You see osseous distortion, you see brain tissue distortion, and the caption underneath the slide said in the book, normal cranium. So you and I looking at this, we say, how could that be normal? It's distorted. But yet all we need to do is look at someone and we see one shoulder high, one hip rotated, one foot externally rotated, internally rotated. You and I are looking at distortion all day long. Now I want you to start thinking about cranial distortion. So I put these 4 words together, craniodural stress syndrome, to sort of explain what it is and the impact of a distorted cranium and what that would have on the rest of the body and the patient's health. So let's dig a little bit deeper. Okay, so Michael is our volunteer, and when we look at Michael, we'll take a look at him from a cranial release standpoint. And always we start from the head. As a matter of fact, I start from the eyes and work down. So let's take a look at Michael's eyes. When I look at Michael's eyes, it's pretty easy for me to see that his right eye is smaller and his right eye is lower. So right eye small, right eye low. When I look at the ears, you can just observe them, but what I like to do is I take my fingers and I actually just place them in the patient's ears, and then I look at that, and it's very noticeable when I do that Michael's right ear is inferior and also anterior. So inferior and anterior. When I look at Michael's maxillary arches, I come under the zygomatic arches here. Again, his right arch is lower. And again, in cranial work, and certainly in cranial release technique, we're looking for the smaller, lower, tighter side. That's the more symptomatic side of the body. So we've looked at the cranium, and you say, well, so what? Well, the so what is, if I take my plastic model here, the so what is, what we just did was we looked at Michael's facial bones. We looked at the one eye small, the one eye low, the one ear inferior, the one ear anterior, the maxillary arch inferior. We looked at all that, and that's now going to translate into a global cranial issue. And that global cranial lesion ends up here at our friend the blue bone, the occipital bone. And at the base of the occipital bone, we have our two friends here, the occipital condyles. And so as the cranium shifts and rocks, so goes the occipital bone, so go the condyles, and therefore so goes the atlas. So being a chiropractor, Michael comes into my office complaining of whatever, and I then palpate his atlas, and it's very noticeable that Michael's atlas has shifted to the left. And from there, Michael, if I could just turn you around maybe, and just face the back. If we look at Michael's shoulders, what you'll see is his right shoulder is elevated. Michael, if you could just put your hands out to the side. His right hip is also elevated. And what I want you to understand here is that from this cranial distortion that Michael is presenting with, you can put the hands down now, Mike, that's then leading to an osseous craniosacral distortion, and we're going to change everything by addressing the cranium. Well, as we just saw with Michael, here's a real skull, and again, everywhere you look at this skull is distortion. You can see here, one eye is lower, the ears are distorted, the external auditory meatuses are distorted. There's distortion everywhere in the cranium. There's distortion at the condyles as well. And if you look inside the cranium, and as my slide shows from Gray's Anatomy, obviously, we're protecting the central nervous system, and every one of these little foramen, if you remember back from school, all the cranial nerves pass through, the spinal cord passes through. This is essentially what makes you, you, and me, me. And again, because of this osseous distortion, that's going to negatively impact the physiological function of the central nervous system. And so moving on, if you remember back from school, and as my slide demonstrates again from Gray's Anatomy, the dura mater, the toughest tissue in the body, stronger than bone, white, inelastic, fibrous tissue. But what I never learned in chiropractic school is that the dura blends in and becomes the periosteum of all 22 of the cranial bones. As if the wallpaper on the wall is the dura. And so as this cranium shifts and rocks and distorts, that dura then tightens. And the best analysis I can give you, and what I use with my patients quite often, is a towel. So imagine that this is your dura, beginning in the cranium, ending in the coccyx, and that dura, of course, is covering the central nervous system. And as that cranium shifts, rocks, and distorts from traumas and stresses, things that we'll cover in a little bit, that dura now tightens down, and this person is now going through life with dural tension. And there's no way that your body will function optimally when you have dural tension. Remember, the dura is covering the brain and the spinal cord. So if someone were to say to me, what's the purpose of cranial release? Well, the purpose of cranial release is really to relax the dural tension to optimize physiological function in the body. And so, again, here's a slide showing the dura, covering the brain, covering the spinal cord. And again, that's what we just covered with the towel demonstration. It was Dr. Sutherland that came up with the concept of the reciprocal tension membrane system. And what he said was, whenever there is cranial distortion or cranial lesion, the dura will tighten and therefore will always cause a misalignment of the sacrum. And I found this to be very interesting. I started in chiropractic school in 1982, and I was fortunate enough to have as one of my professors Dr. Larry Webster. And Dr. Larry Webster was a chiropractor in Atlanta, and he questioned as to why so many women were coming in that were pregnant that were presenting with a breech presentation. A breech baby, as you know, is a foot down presentation. So what Dr. Webster decided to do was he started adjusting the sacrum. He would hold some contacts on mommy's pelvis, and 8 out of 10 times research showed that the baby turned and they had a normal head down delivery. It's called the Webster breech turning technique, and I was fortunate enough to be his student, and he taught me how to do that. So now we fast forward to 1998. I'm doing cranial work in my office. I'm trained in the Webster technique, and I get a phone call from a lady who said that she has a breech presentation. She saw my name on the Webster list. Was there something I could do to help her? And when she came in, we checked her. She did in fact have a misaligned sacrum. I then applied the cranial release technique to mommy's head, went back and rechecked. The sacrum and pelvis were balanced, and that's all we did for today, I told her. I said, come back on Wednesday. And when she came back on Wednesday, she reported to me that she had been to the obstetrician because after she left my office, she felt a lot of rumbling and movement in the pelvis. And what she found and what the obstetrician discovered was that the baby had turned and we now had a head down delivery, and she ended up having a normal delivery. She didn't need the C-section. And that was the first child that was turned, to my knowledge, with cranial release. I now have over 500 students that are out there doing cranial release. And so many people report to me, so many of my students report to me that they're turning babies daily because of this dural tension that's affecting the uterus and where the baby is growing and where the baby is developing. Again, if you work with pregnant women and children, cranial release would be a fabulous way to add this whole cranial concept into practice. If you work with midwives, if you're interested in that, then this will take you, cranial release will take you right into that world. If you tell me, no, you're really more interested in working with athletes, well, I can tell you, and I have some studies to prove it, there's nothing better for an athlete than cranial release. If you say, wait a minute, I don't like to take care of pregnant women and children, I'm not taking care of athletes, I prefer senior citizens, there's really nothing better for a senior than cranial release, and we will talk about that a little bit later as well. So let's move on. And again, 1998, I'm scouring the internet looking for everything I can find on the dura, of which there wasn't much, and I came upon some slides from a medical website. And one of the slides I came upon is this one, which was the lateral view of the brain, the dura intact. And so here we go. Here's the dura covering the brain. Great, we know about that. But then, well, the eyeball's here, but I really don't need to talk about the eyeball because I'm really interested in the dura. Until I go down and I read, and it says that outside the main skull cavity, dural sheaths cover the optic nerves, and the meningeal layer of the dura is continuous with the sclera of the eyeball, which of course means that the white of your eye is a continuation of the cranial dura. So when a patient has cranial distortion, which is leading to dural tension, that will negatively impact how the eyes function. And I've had so many patients report visual improvement after receiving cranial release. The same formula holds true for hearing, sense of smell, sense of taste. So you're into all the special senses. You're into the cranial nerves as well with cranial release. And we want to de-stress the dura to allow the body to function optimally. I mean, that's what we do for a living. So let's dig a little deeper. We'll take a look at this slide, a basal view looking up underneath the brain, and we want to speak about our friend, the pituitary gland. You know, it's so many people out there today have what we might call endocrine problems, right? Sugar problems, thyroid problems. I can't lose this water weight. I can't get pregnant. All of these different issues that are happening. And let's go back to the anatomy. So if we go back to Gray's Anatomy, here's our friend, the pituitary gland, sitting in the sella turcica, the sphenoid bone, and to me, being from New York City, reminds me of an apple or a cherry on a tree, right? Nature seems to use the concept of the stalk and then the piece of fruit, like an apple or a cherry. Well, if you go back to Gray's Anatomy, that stalk has a fancy name. It's called the infundibulum. There's a flap of dura that covers over that valley, and that flap of dura is called the diaphragmacella. That's a fancy word for saying dura. And that dura, by the way, is continuous with the rest of the cranial dura. So remember, as the cranium shifts and rocks, one eye small, one ear rotated, maxillary arch low, the dura is tightening, that diaphragmacella is tightening. And if you go back to Gray's Anatomy and you review this area, they speak about how the infundibulum pierces through the dura. It's piercing through the dura, which is now pre-tensioned because of the cranial distortion. And with that dura being tensioned and tension on the infundibulum and discommunication between brain and pituitary, well, now there's a major foundation for distortion in the body. Thyroid issues, growth hormone problems, adrenal cortex problems, sugar metabolism problems, women that can't become pregnant, women that do become pregnant and then can't produce breast milk. These are all could be secondary to this dural tension. If we go to the posterior side of the pituitary, in particular ADH, that's anti-diuretic hormone. That's the hormone that regulates how much water and fluid is in your body. And so I can't tell you how many cases have come in with patients that start receiving cranial release, and all of a sudden they start telling me that they're losing weight. And what they're losing is water weight because the body is now flushing itself. The ADH hormone is coming back into balance. The body is saying, I don't need this extra 8 pounds of water, which is the weight of a gallon of water is 8 pounds. So as the body starts losing that extra water, a lot of people come in and say to me, gee, I don't know what you're doing, but I'm losing weight. And of course, we're not changing their exercise program. I'm not talking to that about, I'm not speaking to them about that. But what's happening is the body is coming back into balance. And that's what we're all about, bringing the body back into homeostasis, balance. Okay, well, we covered already the cranial bones, the cranial dura, the spinal dura, right? The dura which covers the spinal cord. And now let's talk about the 31 pairs of nerves which branch out from the spinal cord. It's as if the telephone system of the body. How the brain will talk to the heart, how the brain will speak to the liver, how the brain will speak to the arms and the legs. The dura mater of the cord has tubular sleeve-like prolongations which ensheath the roots of the spinal nerves together with the spinal nerves themselves within the intervertebral foramina. These dural extensions are continuous distally with the epinorium of the spinal nerve. Now, when I saw that sentence, continuous with the epinorium of the spinal nerve, I got very excited. I had remembered that term epinorium, and I went back to Gray's Anatomy. And if you remember from your anatomy, here's a cross-section of the spinal cord. Everywhere you see the black line is the dura. So the dura, as we're told, ends right here. But as that nerve continues out to the arms, to the legs, to the thyroid, to the liver, the outermost covering of that nerve is called the epinorium. And the epinorium, according to Gray's Anatomy, is the outermost connective tissue covering of the nerve. and is continuous with the dura mater. So the dura now is leaving the spinal canal and going out into the periphery, and goes out into the sympathetic and the autonomic nervous system, excuse me. And then the anatomy coloring book states that the epineurium becomes the deep and superficial fascia. So that when you're working on a client at whatever portion of their body you're working on, understand you're really working on the tail end of dural tension. If you applied the cranial release first and de-stressed the cranium, restored Dr. Sutherland's primary respiratory mechanism, restored spinal alignment, decreased the tension coming out of the epineurial level, decreased the fascial level throughout the body, the fascial tension within the body. Now you've really changed everything. And then you can certainly go in and give your chiropractic adjustment. You could go in and do your deep tissue massage. You could go in and do your needles if you're an acupuncturist. Anything you're going to do is going to be enhanced by first using cranial release. And then to really sort of cap this all off is the question, how did this begin? When did it begin? Why did it begin? Why is it that virtually every patient you're going to look at will be distorted, will have cranial distortion? And I'm convinced it began at the birth process. And I'd like to speak to you about that right now. Okay, let's speak briefly about the birth process. Here's a plastic skull, a fetal skull. And during the birth process, as the baby is passing through the birth canal, what's happening to the baby's head? Well, it's compression. Compression, compression, compression. The head exits. What should happen now? Well, now it's time for decompression. And that's what kickstarts the primary respiratory mechanism of Dr. Sutherland. So when you talk about modern hospital deliveries today, and you talk about forceps, you talk about the vacuum extraction, you talk about episiotomies, all these different things that could negatively impact this blowout phenomenon. And so in cranial release, we believe the earlier you can get to a patient, the better. Absolutely, the earlier the better. In theory, mommy could deliver a baby and you could apply cranial release right at the time of delivery, after the baby is born, obviously. Better than that, though, would have been to get to mommy while she's pregnant. We want to free up the cranium, de-stress the dura, release the fascia, keep mommy balanced throughout the whole pregnancy, make the labor easier, make the delivery easier, and even better than that would have been to get to mommy and daddy before conception. Then we keep daddy aligned, keep mommy aligned, keep their bodies optimized physiologically, and then when the magic happens, conception happens, and then we have the pregnancy, the labor, the delivery, the birth. All three in the family are receiving cranial release to optimize physiology, and to me that's the big idea about cranial release. Then the questions always come up, hey, what about C-sections? Because of course the C-section, and sometimes it's necessary, I don't want to get in, this is not the time and the place for that, but the C-section of course now is still a traumatic birth, it's still pulling, twisting, it's still major surgery. And of course now the child never gets the compression and therefore never gets the decompression. And the same studies that were done by my instructor back at Life Chiropractic College, Dr. Webster, he found that children born C-section delivery, in general, weaker immune system, more colds, more sore throats, more ear infections, generalized weaker health than children born normal, whatever that means, between the bumps and bruises of a hospital delivery, as opposed to C-section. So regardless of the type of delivery, whether it was natural or whether it was C-section or somewhere in between, cranial release certainly is indicated for all children after delivery or up until the time they come in to see you. So if the child was a difficult delivery and the child's now 3 years old, certainly you want to apply cranial release. The younger the better. Ideally, the sooner the better, ideally. Okay, let's talk briefly about stress and the negative impact stress has on us. It was 1999 when Newsweek devoted its entire magazine to stress, how it attacks the body and what you can do about it. And for anyone out there that studied stress and stress research, we really have to begin with Hans Selye. As you may or may not know, Hans Selye was a medical doctor from Montreal. He won a Nobel Prize in stress research. And one of his famous quotes was that the cause of all disease is unrelieved stress. He also said something else which to me is just as important, and that is that the nervous system, the system that controls every function of our body, the things we're aware of and not aware of, can do one of two things, but it can't do both. And that is, right now your nervous system is either healing and repairing your body, or it's protecting and defending from a threat, and therefore when it's protecting and defending, it can't heal and repair. And so we'll get into this in a little bit, and we'll go through some slides, because at the end of the day, you and I were designed to handle what's called simple stress. The fight or flight mechanism we're all familiar with. Right? We're walking merrily along our way, something causes us to become stressed, our body shifts its physiology, we run from the animal, we run towards the animal, we climb the tree, we do whatever we have to do. The threat ends, we come back to baseline, go merrily on our way until the next stress hit. Well, that was called simple stress. That's how we're wired to deal with stress. We're wired to handle stress. The body's response to stress, the classic fight or flight mechanism, is what everyone knows. And again, at the end of the day, so that we can survive, we can live to talk about it, live another day. Well, now we have the researchers, the new researchers that are saying, wait a minute, the human body was never meant to deal with prolonged or chronic stress. Well, today's stress never really ends. It's not the classic fight or flight mechanism. It's not the animal or the rival tribe of humans of our ancient ancestors. It's more of the constant, chronic, low-level, and sometimes high-level stresses that we can't escape. And so these stress of modern times, which is called a complex or a complex stress, then causes another problem, and that is that our nervous system stays in the fight or flight mechanism. And we now virtually live in the fight or flight mechanism. And again, back to Selye's discovery, the nervous system's either healing and repairing or protecting and defending. Virtually all of us are going through life stuck in the protect and defend mode. We're not healing and repairing, which means we're aging prematurely. The reason I'm bringing all this up is that cranial release will shift you from that protect and defend mode back towards heal and repair. And we'll do that in 1 minute, and we'll talk about that in a little bit. Again, the new research is saying stress is the most widespread problem in America today. It's a major contributing factor in 100% of disease. No one is immune. The Florida Institute of Mental Health, unrelieved stress contributes to family breakdown, chronic health problems like heart disease, high blood pressure, memory loss, depression, even on-the-job accidents and injuries. So again, stress is involved in everyone's life, every day, and cranial release can help you to help a client deal with stress. And of course, if you could explain this to a patient, in my opinion, you'll be so busy helping people deal with their stress from a natural, non-invasive way of cranial release, which takes you all of a minute to do, remember, that you have now the foundation for a fabulous practice, stress-free on you, because you're virtually doing the same technique on everyone, and it's just educating your clients about when they're stressed, they need cranial release, and you're going to do some testing to determine when and how often they need to come and see you, and we'll cover that a little bit later. Well, I'm going to shift gears again with you because we spoke about, the anatomy and the physiology. what about energetics? What about energy medicine of today? You've heard of Barbara Brennan, you've heard of Bruce Lipton, you've all heard of acupuncture, you've all heard of Reiki. Well, cranial release changes the energetics in the body, as reported to me by people, masters in all those different fields. As a matter of fact, we were just at a convention, and I had one of my students that went and took an aura picture, and the aura had its colors. He then came to me, received a cranial release, and I asked him to go back and have another picture done. And when he had the pre and post, the post picture was completely different. All the colors were brighter, stronger, and actually the person who took the aura picture couldn't believe it. She said, how could a 1-minute technique change your energetic field? Well, it did that, and I'm happy enough to say I have the proof to back up what I'm saying. So we know we're affecting energy as well. If we were going to begin the presentation, and if I had only one slide to show you, this would be the slide. To me, the most profound thing cranial release does was change brain hemisphere activity. And so here we have what it's called the normal or relaxed brain, which is working in the alpha phase bilaterally. This is EEGs, and this is what's called being in whole brain function. So this person needs the left brain, the engineering, the logical brain, they tap into that. They need the right artistic creative brain, they tap into that. The doorway is open, and this person is fully functioning in their body, and their nervous system is alive and awake. And so from a psychological standpoint, the person in a fully functioning whole brain is also living in present moment, meaning they're not guilty over the past, they're not fearful of what's coming in the future, they're living in present moment, fully alive, fully awake, fully alert. The problem is, as the stresses, as the storms of life hit, what happens is the brain does its best to handle the stress, but then things shift. And if you look here in the stress brain, you'll notice, number one, we go from alpha up towards beta. That's the more excitable nervous system. That's the more fight or flight nervous system. You'll notice the left brain becomes overactive, and the right brain virtually goes to sleep. So now this person is virtually living in the left brain, which is great if you're an engineer and you just need logical thought. But if you need creative thought, if you need intuitive thought, if you need to come up with a new sales program, come up with a new color scheme for your office, you want to come up with, you want to create a piece of music, you want to create a poem or a story. That right side of the brain, the more creative side, is virtually turned down. Again, from a psychological standpoint, these people tend not to be in present moment consciousness. They tend to be guilty over the past and fearful over the future. So cranial release takes you into a whole new world, working again at the main computer, obviously the brain, the central nervous system, the is of what we are, so to speak. And so cranial release, I can't explain how profoundly you will help patients by applying this technique to people. So before we had Mike come up, and we were kind enough to take a picture of Michael earlier, and when we look at Mike, if we just draw a line with PowerPoint, we can see that asymmetries from right to left side. You can see Mike's head on the top, almost it looks as if it was dented, and that could be forceps. I'm not sure, we'll have to find out from Mike a little bit later. Maybe falls or traumas to the head. Again, when you look at Mike's eyes, the right eye is small, the right eye is low. If you look at Michael's ears, the right ear is inferior, it's also anterior. You can't see that on this slide. And if you look at Michael also, you'll see that his right shoulder is elevated. Again, so all of this from a cranial distortion standpoint, leading then to distortion throughout the body, and this is all going to start to change today with cranial release. The final piece of the puzzle, well, we went through the craniodural stress syndrome. That's the slides we've been going through. Now it's time to apply the global anatomical release. It's time to actually put my hands on Mike's head to change structure, to change function. Remember, at the end of the day, structure determines function. If a patient's structure is distorted, there's no way the physiology will be optimized in the body. And so what we'll be doing is, by changing cranial structure, we'll be changing the reciprocal tension membrane system. You remember, that's the dura mater, the tension in the dura. That will stabilize the spine, release the extremities, release the fascia, rebalance the neurological system, both the peripheral, cranial, and autonomic nervous system. And again, at the end of the day, all of our patients, all the people in your community are looking for improved health and well-being. Cranial release can give this to people, and I invite you to join me on this journey of cranial release. We're going to take a look at Mike from a cranial release standpoint, and kind of some of the things that we covered before. This is sort of my basic evaluation. I have a much more in-depth evaluation, which we'll cover a little bit later. But I like to start with the eyes. So let's take a look at Mike's eyes. And again, the questions are, does one eye look smaller than the other? Does one eye look lower than the other? And if I come in front and take a look here, it's pretty easy to see from where I'm standing that Mike's right eye is lower and his right eye is also smaller. So I'll have my wife just write that on the board. Good. Then we'll go to the ears. I like to just take my fingers and place them in the patient's ear canal. And when I do that, it's pretty easy to see from here that Mike's right ear is inferior and also anterior. So inferior, anterior. If I then go to the maxillary arches, and Mike, just push down into my thumbs, that's it. Again, the right maxillary arch is lower. And so the pattern that we're seeing with Mike right now, again, right eye small, right eye low, right ear anterior, right maxillary arch low. It seems like everything's on the right with Mike. Sometimes you'll see that with patients. Sometimes you'll see everything on one side, everything on the other side. Sometimes you won't. You'll see different, you'll see one eye small on the right, but you'll see the ear lower on the left. You'll see all sorts of distortions. From there, if we then look at Mike's shoulders, and I'll just stand behind, pretty easy to see again that Mike's right shoulder is higher, which would make sense to me because, remember, all this tension that's happening on the right side is now, because of the dural connection, is going to tighten every structure on Mike's right side, and that would make sense that it's going to pull the shoulder up. So right shoulder is high. If I then come and check the distance here between the neck and the edge of the shoulder, and I come here and I check the distance between the neck and the edge of this shoulder, it's very noticeable also that that right shoulder is tighter. It's more bunched, for lack of a better word. Okay? And if I just come in and just gently palpate, much more tension on Mike's right side, which again makes perfect sense from a cranial release standpoint. Mike, if I have you just lift your arms up for me, and I just come here to the belt line, and I look down, and I don't know if you can see from the camera what I see, but Mike's right iliac crest is higher than the left. So he's high on the right here as well. Okay, great. You can put the hands down, Mike. And again, if we look maybe from the side, if you don't mind, Mike, just turn to the side. And if you look straight ahead, depending on what angle you're looking at, you'll notice Mike's shoulders are also rolling forward bilaterally. Both shoulders are rolling forward, okay? And it just looks overall a lot of tension in this area. If we also look and we take a look at where Mike's ear is in relation to the shoulder, ideally that ear should be directly over the shoulder. If you look at Mike, that head is coming forward. That's called forward head posture. And if I were to come in and sort of artificially correct his posture, just pull your shoulders back, Mike, you'll probably see even more that the ear has gone anterior. And again, that's forward head posture. So, Mike, if you could just face the crowd one more time. Great. Okay. There's another test that I like to do, and for that I'm going to need a sheet of paper. So I have a regular sheet of paper, and I'm just going to lay it on the floor, And Mike, what I'd like you to do is just place your feet right on the edges of the paper. So you're just barely touching. Okay, so the push test, I have the sheet of paper on the floor. Mike's feet are just touching the outer borders. Mike, what I want you to do is stay in neutral, just relax. I'm going to press right on Mike's belt line, and you're going to resist me, Mike. And as I start to press, I don't want you to lean your body. I want you just to stay in neutral as best you can. So here we go. And I'm just pressing. Just load up nice and slow. If you do this test to your clients, it's a great test. I highly recommend it. I'll tell you what it means in a moment, but he's nice and strong here. And now I'm going to do the same thing on the other side. So hold again, stay in neutral. And as soon as I load up, you can feel the difference with that, right? All right? So if you come back to the paper one more time. So that's a positive test. Mike fell from right to left. And what that tells me is that in space, Mike's head is off to the left. The head is shifted off to the side that he felt. And the downside of that, Mike, there's two things. Number one, it tells me that you're carrying more weight down the left leg. The problem with that is after the age of 55, the number one orthopedic procedure is knee and hip replacement. The second problem with this is that there's a Nobel Prize winner in biomechanical engineering that determined upwards of 90% of the brain's energy is used to hold us up just in gravity. So, Mike, if you're standing and you're leaning to one side and you're not even aware of it, your brain is already overworking just to hold you up, which means there's less energy available for healing, creativity, all the other things we need our brain for. And so that's all going to change today. Okay? Great. The final test I want you to do, Mike, is what we call the peripheral vision test. So maybe we'll have you just step back off the paper 1 or 2 steps. Great. And what I want you to do is you're going to place your fingers out to the side. Just point your fingers, Mike. And you're going to look at something way in the distance. And what I'd like you to do is very slowly bring your hands in. And as soon as you see the beginnings of your fingers, you're going to stop. Okay. And so this would, in theory, would be Mike's peripheral vision. And you can do a few things here. You could take a picture of it. You could actually measure from one fingertip to another and say it's 50 inches. And I also always have the patient look. So Mike, just look at your fingers without moving them so you see where they are. Because after the cranial release, I'm expecting that to open. I'm expecting his peripheral vision to improve, actually. Okay, great. Okay, Mike, so now we have Michael on the table, and I'm going to check his legs. And I know a lot of you check your leg, check your patient's legs, doing different ways to do that. And we'll talk more about that a little bit later. But most importantly, I want to make sure the patient is aligned on the table, of which Mike is. And I'm just going to come here and do my check. And what I'm finding with Mike is that he's got a right short leg. So his right leg is short. I can double check that by coming here to the iliac crests, and I can just come here to the top of the crests, and his right iliac crest is higher. So Mike, what's happening is, because of the tension down the right side of your body, this whole leg is getting pulled up. It's not that the bone is shorter, it's that the pelvis is getting pulled because of muscular tension, which gives us the illusion of a short right leg. Okay, so that's number one. Short on the right. And now the next thing, Mike, you're just going to relax your legs, and I'm just going to turn them in. And as I do that, if you want to take a look from where you are, Mike, you can see that the right leg, which is short, is also restricted. So you're short on the right, and you're also tight on the right. So let's go back to the brain. This is probably the most important poster chart that I use with patients, Mike. And ideally, I'd like you to be in the middle. When you're in the middle, the brain is balanced. When the brain is balanced, the muscles are balanced. When the muscles are balanced, the structure, the bones are balanced. That's the way you're supposed to go through life. Okay? When you're in the middle, remember before we spoke about your body is healing, repairing, and regenerating itself. Your body is constantly rebuilding itself from inside out. Unfortunately, when we're under constant, chronic, low-level stress, as we all are, physical stresses, chemical stresses, emotional stresses, even EMF stresses, the stresses from cell phone, the energy from computers. We're in a Wi-Fi environment here. One of the brain hemispheres becomes overactive. You're figure number one. Your left brain is overactive because of stress. And the reason why I know it's the left is that the left brain controls the right body. It's as if the wires cross over. So left brain controls right body. And what happens there, you can see the distorted picture of posture that happens. Also now your nervous system is now stuck in survive, protect, defend. It's as if you're constantly under threat and your body can't heal properly, your body can't rebuild itself properly, and that's all going to change starting today with cranial release. Okay? Now it's time to apply the cranial release technique. There are 12 separate steps that I'm going to do on Mike's left side and 12 separate steps I'm going to do on the right side. Those 24 steps together will take about a minute to do. So let's get started. And so that's the cranial release technique. Mike, so let's recheck your feet now and good. Big difference. Already I can see. Good. So there's no more short leg. Much better, Mike. Good. Let your legs just relax for me. Let them just fall. And even that, you want to take a look here, Mike? So even that's much better. So now the right leg was short and was tight, and now it's balanced, which means now you're back in the middle diagram again. And that's the way you're supposed to be. And with regular cranial release care, we'll keep you in the middle. So you'll be able to handle stress better and be healthier in all areas of life. Okay, Mike, so now we're going to just recheck you. And we're going to start again from the eyes like we did before. And so even just standing from back here, it's amazing to see how the eyes are now more level and more open. So it's, again, we want to create symmetry. We want to create balance. Beautiful. When I go to the ears, hopefully you can see at home that the ears are certainly much more balanced. There's no more inferiority and there's no more anteriority. That's improved. If we come down, Mike, just push down. The maxillary arches are much better than they were before. And here's another test that we didn't even do. I mean, because of the cranial release, Mike's posture is so much better that he now appears to be taller than me. You'll be able to see that from before and after. It's as if he grew an inch, and of course he didn't grow technically, but he went from a forward head posture up to normal posture, and that gives the appearance of Mike being taller. So that's great. Good. Let's come back to the shoulders. Boy, that's much better. Shoulders are balanced. When I come and palpate the trap area, much more relaxed, much better. When I come and look here at the bunching or the tightness here in the shoulder area, that's gone as well, so he's balanced there. Mike, just place the hands out to the side for me. When I come here to the iliac crest, he's right on the button, so he's balanced there as well. You can place your hands down, Mike. Just turn to the side like you did before and just look straight ahead. That's it. Even the forward head posture is improved. That's right. You can see how his posture, you can just see his overall level of tension is reduced and his balance is restored. One more time, Mike, just face the gang. We're going to do the push test again with the piece of paper. So Mike, if you remember, just put your feet on the outer edges of the paper. And you're going to stay in neutral. I'm going to press again, and you're going to resist me. Okay, so stay in neutral, eyes open, and hold as I'm just pushing straight across. Very strong. This was the strong side before. Great. Hold again, Mike. Same thing here. I mean, you feel a difference with that?
Definitely.
Definitely. I'm pushing very hard now, whereas before you went right over, if you recall.
Yes.
Step back off the paper. The final test I want to do is that peripheral vision test. So I think you were back just another step, Mike, where you were before. Hands out to the side, looking down to the back. And one more time, nice and easy. Come in nice and slow. And just stop when you see the beginnings of your fingers. Good. And if you look at your hands now, Mike, does that look like it's opened or improved?
Yes.
Yeah. So, I mean, you can see, again, we could have taken a picture, you could have measured, you could actually measure the distance from the finger to the wall if he was standing behind a wall, and that before was up about here. So that's a big improvement. Okay, Mike, so as you can see by the board, everything improved, and that's just one cranial release. The beauty is it's going to keep improving as the day goes on. I mean, you're going to keep feeling changes in your body. But more importantly, from what I have to say, how are you feeling right now? Are you aware of any changes in your body?
I do. I feel more relaxed and I feel light.
You feel light. That's a very common comment from people. And again, your center of gravity was off to the side. You were leaning forward. Everything was kind of heavy, and now everything is light and balanced. So that's great. So congratulations.
Thank you.
This is Dr. Doreste with the Cranial Release Technique. I want to thank you for watching those 4 videos on the preview seminar. And if you notice, the preview seminar is really laying the foundation for the cranial release technique. It's based on science, it's based on anatomy, it's based on physiology. If you click down below, you can register to watch and learn everything there is to know about cranial release in the mastery class. I videoed everything there is, every aspect of the technique for adults, children, someone in a wheelchair, or someone in a hospital bed as to how you can properly apply the cranial release technique to help the client globally and as a wonderful addition to your practice, whatever type of practitioner you happen to be. In addition to that, we go through all the testing protocols. Everything there is to know is on the other side if you click that button below and register. In addition to all the videos, you have access to the CRT resource library. And in there you have the manual, PowerPoints, more information, everything you need to get you ready to take this into practice. Click down below and I'll see you on the other side. Thanks so much. Goodbye.